This video is sponsored by Bootcamp.com. Check it out for INBDE prep and use coupon code MENTALDENTAL for 10% off. Hey everyone, Dr. Ryan here, and welcome to the practice questions video for the oral medicine series. So this is everything that we talked about in this video series, and if you haven't already, I would definitely encourage you to go back and watch the full series before attempting these questions. I broke down the material covered on the board exam into 24 videos of high-yield information, and this information will really help you on the board exam. I compiled 15 questions for us to go through together, and these will be very similar to what you see on test day. So keep track of how you do, and then let me know in the comments once you're done how many you got correct. Alright, so with that, let's get started. Question number 1. During a procedure, a pediatric patient accidentally swallows an orthodontic band and is coughing while remaining conscious. What is the first thing you should do? Go ahead, pause the video, think through the question, and then we'll go over it together. Alright, so this material comes from our CPR video, and a couple of hints are included in the stem of the question. So it says that the patient is conscious. That's our first hint, that the patient is conscious. So what that means is they have a pulse, and that tells us there's no need for CPR, no need for chest compressions, and no need at this point to activate emergency medical services and call 911. It also says that the patient is coughing, which means they're able to get some air in. They're breathing somewhat, even if it's hindered. So abdominal thrusts at this point are not needed either. Encouraging coughing is actually the most predictable way to manage this scenario and the first thing that you should do. So the answer to this question is A. Now, if the patient were to start gasping and stop coughing altogether, then our option would be to start abdominal thrusts. And then if they were to lose their pulse, then at that point we would activate EMS and then start CPR with chest compressions. But for this question and how it's worded, the correct answer is A. Okay, question number 2. Which of the following procedures is not a risk factor for osteonecrosis in a patient taking bisphosphonates? So go ahead, pause the video, think through the question, and then we'll go over it together. So this question came from the bisphosphonates video, and it's asking about medication-related osteonecrosis of the jaws, or MRONJ. And medications like bisphosphonates impair bone healing. Under normal circumstances, that's okay, but if you undergo a dental procedure that exposes the bone, then you run into a potential problem because the bone loses its overlying blood supply from the dental procedure and it can't supply its own blood due to the medication. So it dries out and dies or necroses, hence osteonecrosis. So we're looking for a procedure that does not expose bone. So for the correct answer, we're looking for a procedure that does not expose the bone. So let's go through these one at a time. Apicoectomy involves drilling through the bone overlying an apex of a tooth for direct access. So that's going to expose the bone. Osseous surgery is a periodontal procedure accessing and recontouring bone to reduce periodontal pockets and improve bony architecture. So that also is going to expose the bone. Implant placement is linked to increased risk of MRONJ, and extraction is self-explanatory. We're going to be exposing bone there as well. So all of these procedures expose bone. All of them are risk factors, and so the answer here is E. Question number 3. Nitrous oxide sedation can be indicated for an anxious patient with each of the following conditions except one. Which is the exception? Go ahead, pause the video, think through the question, and we'll go over it together. So this one came from our COPD and asthma video, and the question's asking, when is nitrous oxide contraindicated? So let's go back to that COPD video, and we have a list for the no column. For patients who can't and shouldn't receive nitrous oxide, included things like COPD, nasal obstruction, multiple sclerosis, pregnancy, first trimester especially, any psychiatric disorders, communication barriers, otitis media, and sickle cell disease. So if we go through the answers, tuberculosis is okay, asthma is okay, and congestive heart failure is okay as well. The one that's not okay for nitrous oxide sedation is pregnancy, especially a first trimester pregnancy. So the answer here is B. Question number 4. What ethical principle would you violate if you choose not to treat a patient only because they have an active HIV infection? Go ahead, pause the video, think through this one, and then we'll go over it together. So this question comes from our HIV and AIDS video, and we talked about that a patient at high risk for HIV or AIDS, or with a diagnosis of HIV or AIDS, should, by and large, be treated in a manner identical to any other patient. In fact, withholding dental treatment only because someone has tested positive for an HIV exposure would be a violation of the ethical principle of justice, which says we must be fair in dealing with patients and to deliver dental care without prejudice. We would treat them taking the universal standard precautions, including wearing gloves, masks, goggles, gowns, and disinfecting after procedures, so we keep our staff protected while still giving the patient excellent dental care. So the answer here is D. Okay, question number 5. What is the most common cause of liver cirrhosis? Go ahead, pause the video, think through the question, and then we'll go over it together. So what is liver cirrhosis? Well, it's scarring of the liver in response to hepatitis, which is inflammation of the liver. And hepatitis is most commonly caused by an infection with a hepatitis virus, usually hepatitis A, B, or C. Alcoholic hepatitis is second most common, caused by heavy alcohol use, leading to liver cirrhosis. And then we have toxic hepatitis, which is less common and caused by certain toxic chemicals like chloroform. And then autoimmune hepatitis, which is also uncommon, where the body's immune system attacks its own liver. So autoimmune and toxic are uncommon. Alcoholic is the second most common. Viral is the most common and the major cause of liver cirrhosis. Now, some sources incorrectly say that alcoholic is the most common cause, but in the United States, where the board exam is administered, hepatitis C is responsible for 26% of cases, whereas alcohol is responsible for about 21% of cases of liver cirrhosis. So the answer to this question is C. Question number 6. This patient presents to your office for extraction of tooth number 19. How should you proceed? Go ahead, pause the video, work through this one, and then we'll go over it together. Alright, so this material is covered in the chemo and radiation therapy video, and dental extractions in a patient with head and neck radiation therapy carries risks of delayed healing, prolonged alveolar bone exposure infection, and osteoradionecrosis. So it's prudent to consult the patient's radiologist or physician before performing any extractions. A coronectomy might be a good alternative if the primary care physician says the extraction is contraindicated, but we don't know that until we refer them. And if we just refer to an oral and maxillofacial surgeon, they would still need to refer to the primary care physician anyway. So that's not a good use of the patient's time or the surgeon's time. So ideally, we would perform all necessary extractions before cancer therapy, but if they're needed after, we would refer them first to their PCP or primary care physician. So the answer to this question is D. And note that it doesn't matter how long ago that radiation happened, the fact that there's history of head and neck radiation is enough to take this precaution. Question number 7. What is the main psychoactive ingredient in marijuana? Go ahead, pause the video, think through this one, and then we'll go over it together. So this material comes from the substance abuse video, and psychoactive means mind altering. So a psychoactive drug affects how the brain works and causes changes in mood, awareness, thoughts, feelings, or behaviors. And nicotine is a stimulant drug that speeds up the messages traveling between the brain and body. It's the main psychoactive ingredient in tobacco products, but not in marijuana or cannabis. So we can rule that one out. Tobacco contains nicotine, which again is not part of marijuana, so we can rule that one out as well. Caffeine is a psychoactive drug because it does affect your mood and awareness and things like that by stimulating the brain and the body, but it's not contained in marijuana either, so we can rule that one out as well. And then we're left with THC, or delta-9 tetrahydrocannabinol, which is the main psychoactive ingredient in marijuana that produces that sensation of euphoria. So the answer to this question is D. Okay, question number 8. Which of the following is an appropriate management strategy? Make sure you go through the patient box, read through the answers carefully, and then we'll go over this one together. Okay, so the important part to this question is that the patient's taking warfarin and we have an INR value reported. Now remember, for an ideal therapeutic range, INR should be between 2 and 3. Being too low favors clotting, which is fine if they're going to go through an extraction, but that's not great for the patient's overall health. And then if that INR is too high, it favors bleeding, which can be okay for the patient's overall health if there's an MI risk, but that's not great for getting a tooth extracted. So 2.8 is a good value, and so that rules out options C and D, which suggest that something is wrong with the current INR. By the way, bridging, if you're not familiar with that term, is referring to temporarily stopping warfarin treatment and using short-acting anticoagulants, usually some form of heparin, for a period of time to help that INR get within a therapeutic range. This is not something that's routinely recommended, especially if the INR is already within a therapeutic range. So between A and B, I'm going to pick apart B a little bit. Barbiturates should be avoided because they antagonize the action of warfarin. So if warfarin isn't doing its job, then the patient's INR could get too low, and then they're not getting the systemic benefits from the drug that they need to prevent a stroke or a heart attack in this case. So B should actually be the opposite. Benzodiazepines are preferable to barbiturates in these patients, especially if we're trying to manage their stress pharmacologically. And then for A, aspirin and all other NSAIDs like ibuprofen can make bleeding risk higher by messing with platelets, so they should be avoided. And acetaminophen or Tylenol, with or without codeine, is suggested for pain control instead. So the correct answer for this question is A. Question number 9. What trimester is generally considered the safest to provide routine dental care? Go ahead, pause the video, think through this question, and then we'll go over it together. So this question comes from our pregnancy video, and my memory tip for this is first is the worst, second is the best, and third is the one with the burning chest, meaning you have heartburn and shortness of breath. So the second trimester is generally considered the best or the safest period to provide routine dental care while pregnant. It doesn't mean that that trimester is devoid of symptoms completely, but if you have a routine exam to conduct, a cleaning, etc., then the second trimester is what I would pick. So the answer here is B. Question number 10. It would be safe to use an ultrasonic scaler on a patient with which of the following conditions? So go ahead, read through this question carefully, and then we'll go over it together. So this question combines a couple of videos. It takes some material from the tuberculosis video, hepatitis video, and then also COPD and asthma. So ultrasonic scaling, air polishing, and coronal polishing are contraindicated for patients with certain respiratory issues due to the bacteria-laden aerosols and splatter that can be aspirated into the lungs or spread to other dental staff in the room. So for a patient with hepatitis B, it would not be safe for those in the room because hepatitis B and hepatitis C can be transmitted on aerosols because they're blood-borne pathogens. There are several studies that have been conducted that show aerosols generated during a dental procedure can contain the hepatitis B virus from an infected patient. So it would not be safe for the dental staff if that were the case. With a patient with severe asthma or COPD, ultrasonic use is contraindicated for the health of the patient because they can either trigger an asthma attack or exacerbate COPD symptoms. So we're left with A or none of the above. So if A had said active tuberculosis, then generating aerosols would be a huge health hazard to those in the room. That's not the case for latent TB though, because the bacteria are concealed by the immune system within the patient's lungs and they can't get out for a latent tuberculosis patient. So if we know that that's the case and the patient is not infectious, does not have an active tuberculosis, it would be safe to use an ultrasonic scaler on them. So the correct answer to this question is A. Question number 11. In a patient with multiple myeloma, where would the Bence Jones protein be found to confirm a diagnosis? Go ahead, pause the video, think through the question, and then we'll go over it together. All right, so if you watched my video on multiple myeloma, you probably expected this question to appear in this video. So the Bence Jones protein is a normal component of an antibody's light chain in a healthy individual. But if it appears in your urine, that is suggestive of multiple myeloma. Just one of those weird high-yield facts that you just need to know. So the answer to this question is B. Question number 12. Which of the following is an appropriate mechanism of action for this patient's medication? Go ahead, pause the video, think through the question, and then we'll go over it together. Okay, so of course we have to go through the patient's box to figure out what medication they're talking about, and we see that it's aspirin. Now, aspirin helps to prevent pathologic clotting. So in a patient with a history of a heart attack or a history of a stroke, aspirin can be prescribed daily to prevent these clots from forming. Now note that aspirin is not an anticoagulant because it doesn't directly interfere with the clotting cascade. So D is incorrect. What it does do, though, is disrupt the platelet pathway in order to prevent the formation of unwanted platelet plugs, which are a precursor to the clotting cascade. So what does aspirin actually do? Well, it inhibits platelet activation and aggregation instead of promoting it. So we don't want to promote aggregation of platelets into a plug if we're trying to avoid a stroke or heart attack from unwanted clotting. So A is incorrect. It should say inhibits platelet aggregation. Answer choice C is really tricky because aspirin does inhibit the COX-1 enzyme, but it does so irreversibly, not reversibly, like other NSAIDs. So C is also incorrect. For answer choice B, aspirin does block thromboxane A2 synthesis in platelets by irreversibly inhibiting the COX-1 enzyme in order to inhibit platelet activation and aggregation. So the correct answer to this question is B. Question number 13. Which of the following is a sign or symptom you would likely see in this patient? Go ahead and pause the video, think through the question, and then we'll go over it together. Okay, so we have to go through this patient box and we find Addison's disease. So Addison's disease is an endocrine disorder caused by low cortisol due to immune-mediated destruction of tissue. It's called primary Addison's disease if it's at the adrenal cortex, secondary if it's at the anterior pituitary gland, and tertiary at the hypothalamus. As far as signs and symptoms, hypertension is unrelated to Addison's disease, so A is incorrect. Weight loss is more commonly a sign, not weight gain, so B is also incorrect. And immunocompetence is the ability of the body to produce a normal immune response. However, immunocompromise is more what we'd expect due to the suppressed cortisol levels. So C is also incorrect. And then hyperpigmentation or bronzing of the skin is a common sign that we would see in a patient with Addison's disease. So the answer here is D. Question number 14. Which of the following diseases has the highest risk of being transmitted by a needle stick injury? Go ahead, pause the video, think through the question, and then we'll go over it together. Okay, so this once again comes from a couple of different videos we made: hepatitis, tuberculosis, and the HIV/AIDS videos. So tuberculosis is transmitted by droplet nuclei, not by a needle stick injury. So A is incorrect. And the remaining answer choices are bloodborne pathogens, so they can all theoretically be passed by injury with an infected needle. So the question then becomes, which is the most likely? HIV has a 0.3% risk of transmission after percutaneous injury. Hepatitis C has a 1.8% risk, and hepatitis B has a 30% risk. So hepatitis B is the highest among this list, and the answer is C. And the final question of this video, question number 15. Each of the following is a possible side effect of this patient's substance abuse except one. Which is the exception? Go ahead, pause the video, think through this question, and then we'll go over it together. So this one comes from the betel nut video, and betel nut is the pit from an areca palm tree fruit, and it contains arecaline, which is a stimulant drug. And the act of chewing on the betel nut, especially chronically, can have devastating effects on the oral cavity. It's most notorious for causing this condition called oral submucous fibrosis, which involves collagen deposition into the soft tissues and stiffening of the mouth. So C is incorrect. And this is also a pre-malignant condition for cancer, like squamous cell carcinoma. So B is incorrect as well. Gingival recession is another sequela of chewing betel nut, so D is incorrect as well. And then lastly, there's no established link between xerostomia and betel nut chewing. So the answer to this question is A. That's it for this video. Thank you so much for watching. Please like this video if you enjoyed it, and subscribe to this channel for much more on dentistry. If you'd like to support me, please check out my Patreon page. And thank you to all of my patrons for their support. You can unlock access to my video slides to take notes on and practice questions for the board exams, so go check that out, the link is in the description. Thanks again for watching, everyone. I'll see you in the next video.